at length yesterday. We've been keeping up to date on a whole host of issues, and we're having a very, very good transition. I obviously care deeply about the small businesses. They've been through a lot, but I'm also convinced that the most important thing to do for a small business is to end the COVID era, get us out of this, and obviously protect everyone, protect the people who work in the small businesses, own them, the customers. And my job is to protect people. So I am 110% convinced this was the right thing to do, it remains the right thing to do, particularly with the ferocity of Omicron. And I don't know if there's going to be another variant behind it, but I do know our best defense is to get everyone vaccinated, and mandates have worked. So I'm very comfortable with what we're doing. I totally respect whatever the mayor-elect wants to do when he takes office, but this is the right thing to do now to protect all New Yorkers. Go ahead, Steve.
And just to follow up on that, and maybe your counsel wants to weigh in as well, does it make it at all more legally complicated to specify the size of businesses on a mandate like this? Does it have to be basically all-encompassing, one size fits all, because it makes it more legally challenging to carve out different sizes of businesses here?
You are a perceptive person. I'm going to let Georgia Pestana, who was deeply involved in shaping this mandate, I'll let her speak to the legal thinking, the strategy that went into it. But I think the simple answer is yes. I think the more universal, the better. Not just legally, but it also then creates parity among all the different industries, all different size businesses. So it encourages people to get vaccinated and not think, if they're hesitant, well, maybe I'll go and work in a different company or a different field. A lot of business people said that to us early on, that if we were going to do something, make it as universal as possible, so people would know it's time to get that vaccine. Georgia, why don't you talk about the legal strategy there?
Thank you, Mr. Mayor. As always, we've been guided by the health professionals, and there is no difference in employees who work for a large employer as an employee that works for a small employer. They're all at risk, and there is no public health reason to distinguish the two. The stronger the public health reasoning, the stronger we are able in defending any challenges. We have not gotten any challenges thus far, knock wood. I think that we will prevail should those challenges come, because the mandate is grounded in solid public health advice and reasoning, and that reasoning goes across all sizes of businesses. I will also add that we have, through Small Business Services, had a number of conversations with groups of small business owners to help them understand and get compliant, and they have been appreciative, and we will continue to help people and businesses come into compliance with the mandate, because it's important for the health of the city. Thank you.
Thank you very, very much. Go ahead.
The next is Dana from the New York Times.
Hi, Mr. Mayor.
Hey.
I'm not sure if you'll answer this. I think you're kind of dancing around this particular question a little bit, but if you had to put odds on how likely you think Eric Adams is to continue the mandate, what would those odds be?
Well, I admire both the question and the fact that you gave me the space. I wouldn't call it dancing. I would call it this simply: I'm not going to predict, and he will obviously make his own decisions and speak for himself. But I believe, Dana, truly that the universality is a strength in every sense. So I feel, as he does, a sympathy that small businesses have been through a lot of challenges. But I also believe ultimately it benefits the small business, not only on a health level, but again, if everyone's under the same approach, then for a small business, it does not leave that possibility of someone say, oh, I'm going to leave here and go to this other place because I don't feel yet ready to get vaccinated. No, everyone has to get vaccinated. And what we found is, except for an extremely small number of people who are just, ideologically absolutely set in their opinions, the vast, vast majority of people are moved by both the science but also the practicality of something like a mandate. That's why we have 91% of adults in this city have had at least one dose. 94% of the city workforce. I mean, if that isn't a recommender for mandates, I don't know what is. Go ahead, Dana.
Thank you. And then on a related note, can you just walk us through what enforcement will look like?
Yeah, very much like we have had with Key to NYC. And I want to remind people, when we made this decision to do a more universal mandate, it was based on actual experience with the private sector in the Key to NYC, indoor dining, entertainment, fitness. There's a lot of prediction in the beginning, oh, this is going to be such a disruption and businesses wouldn't be able to deal with it. And, I hope people have experienced that businesses have adapted very, very smoothly to it. We did a lot of education. We did a policy of an inspector shows up, there's a problem, talk to the business, say, hey, here's the problem, let's correct this. Please confirm you can do that. And overwhelmingly, the businesses have done that. So in fact, with Key to NYC now over months, we had very few times when we had to give a penalty. We will give a penalty if someone flatly refuses, but that's very rare. So our inspectors will be out there energetically, but with the goal, educate and correct, ideally avoid penalties.
The next is Courtney from New York 1.
Hi, Mr. Mayor. Hope you had a good holiday.
And you as well, Courtney.
Thank you. So given the number of cases over the last couple of weeks, I wanted to check in to see if you're experiencing staff shortages at any first responder agencies or really any agencies. I know there's been some reporting on a shortage potentially of EMS personnel over the Christmas holiday. Can we get an update on those first responder agencies, NYPD, EMS, and FDNY, et cetera?
Courtney, thank you for the question. And I'll tell you, first of all, of course, we know in every part of the city that we've seen people out with COVID. Thankfully, again, more mild cases and therefore for 10 days. But it has not affected the operations of the city. That's the bottom line. Our agencies are very, very agile and very good at what they do, and they have tremendous resources, but they also went through, the crucible of the spring of 2020 when you were talking about massive numbers of people out simultaneously, and they kept serving New Yorkers to their great credit. So nothing we've experienced in the last few days has fundamentally affected the ability of our agencies to get the job done. Go ahead, Courtney.
And also to piggyback on Dana's question on the enforcement element of this, what agency exactly is responsible for making sure all of these businesses are complying? And are there random spot checks? Is that what employers should be prepared for? Should inspectors show up at small businesses and say, show me your paperwork, et cetera?
Yeah, I'll turn to Dr. Choksi because obviously Department of Health plays a particularly crucial role, but a lot of sister agencies have gotten involved in this effort, as we've done previously during COVID. Yes, of course, businesses should expect inspections as per usual for so many reasons. But again, with an attitude of let's make sure things are working for everyone's health and safety. We're not trying to do gotcha. We're trying to just make sure we keep moving forward. So in terms of health department, how they're approaching it, and obviously leading other agencies in the effort, Dr. Choksi, why don't you jump in?
Thank you, sir. And yes, as you say, it is a multi-agency inspection force, which is very similar to the way that we conducted engagement and then enforcement related to Key to NYC as well. It's a combination of dedicated inspections specific to the private sector mandate, as well as incorporating checks related to the rules under the mandate in other routine inspections as well. But the most important point is the one that the mayor has already made, which is that we seek to work with businesses and business owners so that everyone can come into compliance for the simple reason that vaccination is good for business. It helps us to keep our economy open and running, and it helps to keep employees and all New Yorkers healthy and out of the hospital. Thank you, sir.
Thank you.
The next is Julia from The Post.
Hey, good morning, Mr. Mayor.
Hey, Julia, how was your Christmas?
Oh, my daughter was very sick, so there was not a lot of sleep and a lot of
I'm sorry. Sorry to hear
that's
that.
how it goes.
It'll get better as they get older.
Yeah, I hope you and your family had a good holiday as well.
Thank you, yes.
So just continuing with the same theme here, do you expect the city to issue fines before you leave office in the next few days here? And if not, are you really leaving the difficult part of this mandate, the enforcement part, to Eric Adams?
No, I don't see it that way at all. Appreciate the question, but I'll tell you why I don't see it that way. Because we have a body of evidence. When you think of all indoor dining, fitness, entertainment in New York City, that's a huge number of businesses. We've done this work already and found that we did not need to fine. Now, if we ever do, and again, a few cases we did, and we will. And if a business today, if inspectors go and the business says, I absolutely positively refuse, of course they're going to get a fine. But that's not what we typically find. Overwhelmingly, we find businesses that are ready to comply. Sometimes they're not sure about some of the details. Sometimes they need some help correcting a situation. But no, if someone refuses, of course there's penalties. But very, very few people do, is our experience with the really substantial body of work we already have. Go ahead, Julia.
At the top, you said that you've gotten a lot of questions and concerns from private businesses about the mandate. What are those?
I think that, first of all, they have wanted to know how inspections would work, exactly what we're talking about here, and we've reassured that the goal is to get to a positive outcome. There's been concern about making sure that they understood what was required, how to go about it. Obviously, that if they wanted to provide a reasonable accommodation process, how it worked. So it's been a good dialogue, and we've reached out to many, many different business organizations. And what we're finding is broadly an understanding that the universality helps everyone, that the city government leading the way takes a burden off business, and especially that COVID is bad for business. That the one thing that would be most devastating is shutdowns. And so an aggressive action to make sure we do not go back to shutdowns and restrictions actually is very friendly to the needs of business and keeping people employed.
The next is Maya Kaufman from Cranes.
Hi, Mayor. I want to revisit the question of a remote work policy for city employees. Since I've been told that at an internal health department town hall, Health Commissioner Dr. Chokshi had told employees that he and other agency leaders have raised the issue of a teleworking policy with you in City Hall. So why do you continue to resist allowing telework for those workers who wish to do so?
Well, thank you for the question. I think that what is most important to begin the conversation with is we have a highly vaccinated workforce, and we all know there's a profound difference when you're in an environment where people are overwhelmingly, if not totally vaccinated, everyone. There's a huge difference there. Second, we have workplaces that have been meticulously supported in terms of health and safety measures. So when you're in a public sector workplace, it is, to me, from those facts, it is a much safer environment than many others. But it's also because the work people do is crucial to keeping the city moving. And that work is being done best if people are in their workplaces. So that's what I believe. That's what we've been doing. It has been working. The city government has been performing at a very high level and helping this city to move through COVID and recover. And that's what I think makes sense. Obviously, new administration will evaluate, but I think we've proven time and again that this is what works best here and now. Go ahead, Maya.
Yeah, I want to follow up on that and ask, what is the downside of allowing more flexibility for municipal workers, especially given that a lot of workers have children at home who are too young to be vaccinated, who might be around vulnerable people, might be immunocompromised, and really told me they want to have that option.
Maya, there's, first of all, as has always been true, if there's an exceptional situation, anyone can raise that to a supervisor, and supervisors obviously have some latitude to deal with situations. But on the bigger point, it's because we need the very best work done right now. I mean, people who, again, I have a very strong feeling about public service. And people who are in public service take on a particular set of responsibilities. And right now, we're still very much in a crisis. We've got to fight our way out of this. We've got to put the COVID era behind us. Our public workers, I have seen this many times over, the best work happens in the workplace, the most collaboration, the most productivity, the most ability for there to be communication. We need that now. So if there's exceptional situations, of course, supervisors will entertain it. But for what's good for the people, and we're public servants, our obligation is to the people. What we're doing now, I believe, is what's best for the people.
The next is Janae Caldwell from News 12 Brooklyn.
Hi, can you hear me?
Yeah, how you doing today?
Good, how are you?
Good, but pronounce your first name so I get it right.
Oh, it's pronounced Janae.
Janae, okay.
Thank you so much. So I'm sure you know about the really long lines at city testing sites across the city. Some people are telling us that it's taking them as long as maybe 4 days to get their testing results. And we're also hearing that some of the city website systems to make appointments are crashing because the volumes are just so high. So my question is, are you aware of this issue? And if so, what are you guys doing to expedite the process of people getting the results in just a faster time?
Yeah, thank you for the question, Janae. I will turn to Dr. Katz and Dr. Choksi. I think we've got a couple different things going on. First of all, I don't blame anyone if they look at a site and they look at a line. Doesn't matter to New Yorkers whether it's a city-sponsored site or a private site. They just see, testing with a line. We've had a very different experience at the city-sponsored sites in terms of the turnaround time with the test results. I'll let Dr. Katz speak to that. And obviously the goal here is to make sure the information we put out there is accurate and people can get appointments. I know there's been a huge, huge intense demand. So first on the test result time, Dr. Katz and then Dr. Katz and Dr. Choksi on what's going on with the websites and keep them up to date and whether they are performing even with this high demand. Dr. Katz.
Thank you so much, sir. And it has been a challenge to keep up with New Yorkers who are going for testing, and we applaud them for that. They want to keep themselves and others safe. Happy to say that any test done now at a city-sponsored health and hospital site is having a 24-hour turnaround. I just reviewed the data this morning. We are aware that many of the private sites are running longer turnaround times. So we're very proud that we've been able, because the city built its own lab, we are able to get 24-hour turnaround times. In terms of testing resources, we have redeployed workers to our testing sites to keep lines as short as possible. We recommend people check out the website to look at length of the line before choosing one, because we do note variability depending upon, we can't always control how many people go to a particular site at a particular moment. So New Yorkers on our website can always find a shorter time. Thank you, sir.
Thank you. And Dr. Choksi, on certainly update people on the website situation as you're seeing as well.
Yes, sir. I'll provide 3 brief updates. First, on the websites, as Dr. Katz mentioned, we are seeing unprecedented demand, but for the city websites, we are able to keep up with the appointments that are being made. So I encourage anyone who's looking for a testing site, go to nyc.gov/COVID test, or you can also call 212-COVID-19 or text 85548. If you text COVID test to that number, you'll find a site that is close to you in the zip code of your choice. The second thing that I wanted to mention is, as Dr. Katz has said, for city sites, turnaround time for test results is within 24 hours. For the city as a whole, The significant majority of tests are coming back within 48 hours. But if you do need that accelerated turnaround, again, the city sites are your best option. And the third thing that I'll say is that thanks to Dr. Long and his team, additional capacity is coming up online every day this week. There are 7 new brick and mortar sites that the Test and Trace Corps has stood up for this week. And so for both PCR tests as well as the at-home rapid test kits, that capacity will ramp up through this week and into the new year. Thank you.
Thank you. And Dr. Ted Long has joined us. Dr. Long, any tips you want to give to people who are trying to figure out how to navigate all this?
Yes, the simple tip is come to one of our sites. As of Friday, our turnaround time is now back down to 24 hours median at our lab, which services all of our sites. The lines we're controlling by handing out home kits and opening 7 sites near new today and 40 sites throughout this week. So simply put, our sites are walk-in. Come to see us. We have the fastest turnaround times in New York City.
I like it. All right, Janae, go ahead.
That's all I had for you. Thank you.
Thank you very much.
We have time for 2 more for today. The next is Gersh from Streets Blog.
Well, how you doing, Mr. Mayor? Hope you had a nice holiday.
I did indeed, Gersh, and how was yours?
Oh, fine, very relaxing, and I hope this isn't the last time we talk, but if it is, thanks for taking my questions all these years.
It's my pleasure, and Gersh, we will either meet again professionally or on the softball field.
No question about it. So anyway, Mr. Mayor, driving is something you and I talk about a lot, and driving is up, and it remains a legacy of your 8 years in office. Now, some of it is obviously pandemic related. For example, just use a typical Tuesday, December 14th, about 900,000 cars crossed the MTA bridges and tunnels, which is about 103% more than a normal pre-pandemic day. So that's obviously pandemic related. But total vehicle miles traveled in this city was up almost 2% between 2013 and 2019 before the pandemic. Now that's a small percentage increase, but that translates literally to tens of millions more miles being driven in cars. Now you and I have spoken a lot about the need to improve mass transit and to encourage mass transit, but it is a legacy of your 8 years in office. So I wonder if you could talk a little bit about why you have done not enough to reduce driving, and in fact it's going up.
Yeah, of course, we always have a spirited discussion, and I'm just going to challenge. I don't put that one on my legacy tote board there. I just don't. Look, we have a society that over many years, I remember when I first moved to Brooklyn, there were so many fewer cars around, and there's been an explosion of car ownership in general over the last few decades. That is a bigger societal phenomenon. The answer to it is to create more and more and better mass transit, and to discourage car use in the positive way with mass transit, but also in the smart way with congestion pricing. And obviously, this is something I'm frustrated about because I think it should have been here already. And I believe if we put real pressure on the state and the MTA, we can get forward motion. If we don't, I think they'll just keep slow walking it. So I am very comfortable that we did a lot of the things, foundational things, including what we did with busways and select bus service, expanding bike lanes, NYC Ferry. These are all things that are going to grow a lot more. And that's crucial to how we turn around car usage in this city. Go ahead, Gersh.
Okay, sort of a follow-up. I wanted to ask you about today's big public push that you are talking about congestion pricing a lot. Now, you're such a convert at this point, but you were very late to support congestion pricing. So how do you talk to people now who, like you until recently, remain opposed to it? In other words, you had the mayor of London on talking about the positive benefits of it, but there are a lot of people who are still opposed to this, and you've talked about those benefits. So what do you say to them?
I appreciate that question a lot, Gersh. I think, in fact, converts are often folks who can speak with most passion. I had real doubts for a long time. I really did. And it was largely because of the way the plans were constructed that I worried that they would have an undue impact on folks in the outer boroughs. And obviously, I represented a council district in the outer boroughs. And I was not satisfied at what would happen with the money. I remember vividly, with all due respect to Mayor Bloomberg, and to his credit, he was pushing a good basic idea. But the plan, to me, was not structured as well as the current plan. And also, there was not confidence. I remember we used to talk about needing a lockbox to know that the money would actually go to the MTA and not be siphoned off to other needs. This current plan that was finally passed by the legislature, which I strongly advocated for, answered my core concerns. So I became a convert because I said, well, this is a much better plan than anything we had seen previously. Also, the MTA crisis, the subway crisis, grew and grew and grew. Even when you compare to 10 years ago, the challenges in the subways are much more profound, and we have to get renewable revenue for the subways. We have to protect the subways, and congestion pricing is the way to do it. So I became a convert because the world changed. Subways got worse, needed more help, and the plan got better. Now I would say to anybody, we're in an entirely different world than when this plan was first talked about in New York City, over a decade ago. We have the climate crisis bearing down on us. We have to take much bolder action. Congestion pricing is part of that. We've got to protect our subways. If the subways don't get better, New York City doesn't get better. And this plan is fair. If you drive, on the FDR, but you don't go into the central business district, you're not penalized. There's elements of this plan that are very smart, very fair. And I would urge people, get behind it, because we need to do this now. Also, the congestion crisis, last point, Gersh, the congestion crisis, your numbers you gave are striking. We're all living it, but it's good to hear these numbers. The impact of COVID on people using their private vehicles more than ever. It's been devastating and horrible for the environment and horrible for congestion. We got to turn it around. Congestion pricing is if we're going to break out of this current immediate culture, congestion pricing is one of the best ways to do it. But it's not moving, and the state and the MTA have to move it.
Last question for today goes to Chris from the Daily News.
Good morning, Mayor. Thanks for hosting Patty Smith on today's briefing. That was a great start to the Monday, like someone else said at the top of the briefing.
Chris, I have to say, there's something mesmerizing about her work, but also I didn't know what the effect would be here in this room, but it was absolutely beautiful. Thank you for saying.
Of course. So back on the private sector vaccine mandate, I was wondering, do you or any of the health experts on the call have any data yet on how many reasonable accommodation requests have been received, and any timeline on how long those take to process? And then lastly, if there is actually a deadline by which workers have to submit those requests?
So I'll let Georgia Pestana, our corporation counsel, speak to the process there, and Dave Choksi as well. We had a great experience with the Key to NYC with businesses figuring out the right way to implement things and address employee concerns. I predict the same exact thing here. But we're willing to work with any business with any concerns they have to make sure that if they want to put a process in place, that it is a good process, it's one that can be done quickly and be fair. Let's start with Georgia Pestana.
Thank you. Reasonable accommodation requests by private sector workers go to their employers. They do not come to the city. We're not collecting them. We're not deciding them. It's the employer of the workers that receive the requests and make determinations. As to a deadline, we had suggested that December 27th, today, would be at the deadline for employees who request reasonable accommodations from their employers to get them in, and those workers can continue to work under some kind of accommodation while the employer considers the reasonable accommodation request. But those are all going to their employer, not to the city.
Excellent. And Dave Choksi, you want to add?
Sir, nothing to add to that. Thank you.
All right, great. Go ahead, Chris.
Thank you. And I guess it's kind of on the same topic, but as businesses and and individuals across the city are being required to take various health precautions because of the pandemic. I guess I'm wondering, we haven't heard in a while what precautions you're taking. How often are you getting tested right now? Are you taking any other precautions in addition to testing as Omicron continues to surge? Like, what are you doing to make sure you don't get the virus?
Well, thanks for asking, Chris. And I'm doing what the doctors tell us all to do. First of all, I got the booster live on TV, and thank you again, Dr. Choksi. Again, Chris, I can't emphasize enough that's like number 1, 2, and 3 thing to do is get vaccinated to the maximum level you are eligible for right now. We still have, even though 91% of adults are vaccinated at least 1 dose, we still have a lot of people who could get vaccinated and a lot of younger New Yorkers. So that's the overwhelming thing. But it's also, use a mask regularly. Just be mindful. As you know, we were looking forward to gatherings, including with our colleagues from the media, and we, with agreement from a lot of folks in the media, decided we wouldn't have some of the gatherings we might have. So it's a lot of just basic precautions. But I'm going to let Dr. Choksi weigh in and have the final word here because he has done a great job as the city's doctor of reminding us of the simple, smart ways to protect ourselves, particularly those who are most vulnerable. So Dr. Choksi, tell us again.
Thank you so much, sir. And I really appreciate the ways in which you have emphasized precautions during this uncertain time with Omicron. And our key message has been that there are a number of things that we can all do to protect ourselves, protect our communities, and to protect our city. First and foremost, as the mayor has mentioned, is getting vaccinated. And for everyone who is eligible for a booster dose, get one when it's your time. That means any adult who is at least 6 months after their Pfizer and Moderna second dose or 2 months after their J&J dose, you are eligible right now, and you should go ahead and get your booster and take advantage of the $100 incentive before the end of the week. The second thing is the importance of masking, particularly masking indoors. And we have made a recommendation to consider higher grade masks like KN95s, KF94s, or N95s for people who are particularly vulnerable and at higher risk. The third piece is getting tested. We recommend people to get tested, of course, anytime they're experiencing symptoms, and sooner is better if that's the case, as well as before and after travel or gatherings. And that's why we've done all of the work that we have to ramp up testing capacity to be able to support that. The final piece is for people who are at higher risk, if you're an older adult, if you have a weakened immune system, or if it's a child who's not yet eligible for vaccination, this is a time to take more care, avoid some optional activities, particularly anything that is indoors and crowded, and allow for the overall level of community risk to come back down as we navigate through the Omicron surge. So those are our key precautions, and if we take them, we will get through this. Thank you.
Amen. Beautifully said, as always, Dr. Choksi. So everyone, just quickly, a programming note that we are going to have another press conference tomorrow. There's a lot going on, a lot we want to talk about. And then final press conference of the year will be on Thursday, the 30th. And again, I'm going to be expressing a lot of gratitude throughout the week. My gratitude to all New Yorkers who have been part of keeping each other safe. Everyone who went and got vaccinated, thank you. It makes such a difference. And please, 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 if you haven't gotten that booster, please get it by December 31st for your sake and your family's sake and everyone's sake. But also get that incentive. Everyone could use a little more money in their pocket right now. And if you've gotten the booster, tell everyone in your life how important it is, because it really is pivotal to protecting everybody and reducing the impact of Omicron. And tell them there's a $100 incentive that goes with it, and you're definitely going to get some people's attention with that. So everyone, thank you, and we'll see you tomorrow.